Hi, my name is Pip Inge. I'm one of the medical doctors here at the VIS, and today we're going to be talking about IVF and egg freezing. So IVF is essentially a process in which we have the capacity to try and make a baby and an embryo outside of the traditional ways and outside of the body. What it involves is, in order to have a baby, we need three things. We need an egg, we need a sperm, and we need a uterus. And they can be done in a whole variety of different ways, and IVF is a really nice example of this. IVF involves taking an egg from the female, a sperm from a male, and putting them together, essentially in a test tube, and then re-implanting it into the uterus in order to grow a baby. The reason people choose to do IVF, some people choose to do IVF because they only have two out of those three things. They may have an egg, but they need to have a donor sperm. They may have had trouble falling pregnant for whatever reason, and they need some assistance to do that. Or they may choose to be having a baby alone. So there's a variety of different reasons why IVF is the right choice for people to go down that pathway, and it's a really important conversation to have with your treating doctor. In terms of the process of what IVF would look like for you as an athlete, essentially the first process is something called egg collection, and this can be done for the process of IVF or to actually freeze your eggs and hopefully preserve your fertility going forward. Once you decide to go down that pathway, what will happen is you will get your period, and when you get your period, you call the IVF specialist and you start medications on about day 2 or 3 following your period commencing, which is a self-injection medication at home. You continue that medication for around 10 to 14 days, and through that period you're monitored closely by the IVF team with regular ultrasounds. Once it gets to a certain stage, they give you what's called a trigger injection, which will then cause your ovaries to release the eggs, and then you'll have a very small procedure to collect those eggs. Pending what you do with them then, if you go to freeze your eggs, they're then essentially frozen and put into the freezer for when you want them, or if you go down the IVF process, they're then mixed with the sperm to hopefully create an embryo. So the reason that in IVF we have the injections is because we want to stimulate multiple eggs in that one cycle. If you have a normal menstrual cycle, usually you release 1, occasionally 2 eggs each month. What we're trying to do in the IVF process is speed that up and ideally collect anywhere up to 20 to 30 eggs if you're really lucky. So what we're trying to do is hyperstimulate the ovaries to create a larger egg collection at that point in time. Egg collection is a very similar process to IVF. However, rather than at the completion of that mixing the egg with the sperm and creating an embryo, the eggs are essentially frozen as is and put on ice for when you want them down the track. The reason people choose to freeze their eggs mostly is around trying to preserve fertility. So when people get a little bit older, they may decide that they're not ready to have a baby, but they're concerned that their fertility will decline going forward. So it gives them essentially a bit of a safeguard to hopefully have something ready for later if need be. It's really important to note that it's not foolproof, and freezing your eggs will not guarantee fertility, but certainly gives you another option down the track. The time that I think it's worth starting to think about egg freezing is really around your 30s if you're not thinking about babies in the next couple of years. The evidence suggests that freezing your eggs under the age of 35 is the best time to freeze your eggs, and the Goldilocks years, so we call them, are around 28 to 32. So under the age of 35, we expect we may get 10 to 20 eggs per cycle. By the time we get closer to 40, it's usually significantly less than 10. On average, to be able to create a couple of embryos, and again, an embryo doesn't guarantee a successful pregnancy, 10 eggs usually gives you between 1 to 4 embryos. So if we're talking about numbers in terms of how many eggs we want to collect, ideally more than 20 is really what you're looking for at a minimum. So often it will take more than one cycle to get those numbers. If you choose to freeze your eggs or an embryo, they can stay on storage essentially as long as you want them to. So there is no time frame in which you need to use those. From an IVF perspective, it is a very expensive process, and unfortunately there's no two ways around this. It's not necessarily funded by Medicare or private health insurance, and usually comes at a cost of around $8,000 to $10,000 to go through that process. It can be more depending on how many cycles that you need to go through. If you choose to freeze your eggs or your embryos, there's a storage cost of about $500 a year, give or take, in order to do that. But again, these are things that you'd need to discuss individually with the IVF clinic that you're using to go down this process. From an athlete perspective, what would you expect if you were going down that egg freezing or IVF pathway? I think the first thing to consider is the timing of it. You need to be in your home city, whether that's Melbourne or elsewhere, for a period of time to enable this to happen. You can't be travelling through that period given the regular injections and the regular follow-ups and ultrasounds. So you need to find a window of 2 to 3 weeks where you can be a little bit flexible and be centred in Melbourne or similar. You need to acknowledge that during that time you probably won't be feeling your best. As time progresses, usually early on it's okay, but by day 4 or 5, most people start to feel quite bloated and pretty uncomfortable. There is quite commonly quite a bit of fluid retention, and people can put on between sort of 1 to up to 7 kilos of fluid during that time. There is no reason why you can't continue to train if you feel okay. Some people feel absolutely comfortable, others feel that they need to back off and give themselves a little bit of space during that period. In terms of contact sport, there is no complete contraindication to continue to train and compete. However, there is a theoretical risk of damage to the ovaries, so usually we'd advise those who play in a contact sport to aim to do this in the off-season where they can avoid that if it is at all possible. But again, this is something that you can individually discuss with your IVF doctor. I think the other one to be really mindful of is it's easy to underestimate the psychological impact that this can have. Obviously, if you've had a long fertility journey and you've been unsuccessful, it can be really challenging to need to go down that IVF process. It can be time-consuming, expensive, and quite emotional. On top of that, you're throwing in a whole lot of hormones, and hormones can make you pretty emotional as it is, and we're really ramping them up pretty significantly as well. So don't underestimate the social supports you need from family, friends, and those within your sport too. Obviously, these are things that can be highly personal, but other people feel that it's something they like to be open about within their team environment as well. It's really up to you as the individual to who you'd like to disclose this to or discuss it with, but obviously when people know what you're going through, a lot of the time that allows for more flexibility and more understanding for some of those challenges that may occur. If you feel comfortable, I'd encourage you to speak to somebody within your daily training environment, whether that is your coach, a fellow athlete, your S&C, a physio, but somebody who you trust within that environment to help you navigate that while you go through this process. Obviously there's different reasons that people go through IVF. Some is for necessity for fertility in a heterosexual couple. For same-sex female relationships, this is the only way in which you are able to fall pregnant. So pending what that reason is, it can be a really daunting and really scary time to walk into an IVF clinic, or it can be a really exciting time because this is your one chance to have a baby. So be mindful of those different relationships in that environment too and where your personal circumstance sits.